The American people, especially vulnerable women, vulnerable children, vulnerable senior citizens, now get to pay more and they get less. That's why we're here. Because we're saying, let's repeal this failure before it literally kills women, kills children, kills senior citizens. Let's not do that. Let's love people. Let's care about people.
Congresswoman, can you get your girl? I mean, health care reform is literally killing women, children, and seniors.
She deserves an Oscar, is all I say. You know, actually, the Affordable Care Act, even though it's not been fully implemented, people have already seen, we've seen huge changes. The cost curve, as you pointed out, of health care has come down. People have gotten these $1 billion in rates. We have seen the lowest health care cost peaks in 50 years. The provision that the Affordable Care Act has in it that says that, you know, that if you spend over 20% of the money on administrative costs or profits, you'll have to do it. It really provides a disincentive for raising health care costs. And there have been monies put out there for these review boards to really check insurance companies with regard to raising the health care premiums.
And so because it does rely on insurance companies, Jay, the key issue right now that we're about to implement is the state exchanges. So remind folks, because they may not understand all this, what the state exchanges are, and tell me a state that is a model, that is doing this right.
Yeah. Exchanges are websites. Exchanges they're places to buy insurance, and today, for most people, the place is going to be on the internet. So regardless of what state you live in, if you don't get insurance at work, you'll be able to go on the internet, you'll answer several background questions, but you punch in the answers to 4 questions, which are age, location, which will be zip code, family size, and whether you smoke or not. And based on those 4 questions, you will get quotes from every insurance company selling insurance through the exchange. That's a terrific thing. And so people won't be able to be turned down because of health status. They won't be able to be charged more based on health status. And so what this will do is it'll facilitate competition. It will allow people to make apples-to-apples comparisons. They'll see which company is selling the best product for the lowest price. And that should drive down prices.
Right, but it only works, right, if everybody comes into the system, right? The whole idea of insurance is that works if you have an enormous number of people who are all logging on, answering their 4 questions, and buying insurance, right? If only sick people, right, if it's only at the moment where I'm like, uh-oh, let me go get my insurance, right? So how do we make sure that the young, you know, 27-year-old, perfectly healthy woman and the elderly gentleman without insurance all sign on?
There are a couple of ways, and the bill the Affordable Care Act provides funding for what are called navigators, which are people or organizations which are going to help people sign up to work through the system. But most importantly, as I said earlier, the insurance industry insurance companies have to sell through the exchanges. They can't afford not to. This is a huge new market of an estimated 16 million people. Insurance companies have to sell to these people. In addition, they're losing business now, which will now go to the exchanges. So they have to sell through the exchanges. Insurance companies, whatever you say about them, are terrific marketers. They've been able to persuade people to buy to buy poor value insurance for high prices. They should be able to persuade people to buy good value insurance for a reasonable price.
Give me one state that is doing it well.
California.
Okay, give me one that's doing it badly. I will. Oh, Louisiana. Texas. Right. Texas, right. But your language about navigators, right, makes me think, Rebecca, about the work that you've been doing for a really long time, right? This idea of trying to look at the thing that is health care and recognize its complexity and get people accessing it in a very different way.
Absolutely. I mean, I think one of the questions that's arisen is, you know, will there be enough primary care doctors given all the new patients coming into the system? And, you know, I think the way to think about that is how do we best leverage the time of physicians? So there was a study that was done by the Robert Wood Johnson 1,000 pediatricians and primary care doctors, and 80% of them said that they thought it was as critical to address patients' social needs as their medical needs. But 80% also said they didn't have the capacity to do that. So how do we think about medical assistants, peer coaches who live down the block from someone and can, direct them to a great fitness program in the neighborhood, or in the case of Health Leads, how do we use college students who are really good at Googling to track down that nearest food pantry for a family?
Right, because I'm thinking, as Jay describes, going on the internet, I'm like, oh, that, I whip out the iPad, go on the internet in a heartbeat. But there are folks in my neighborhood, first of all, who don't have access to the internet, and then secondly, you saying you're going to go answer 4 questions on a healthcare exchange, which is a website, might as well, just be anything. How do we start to create the political will to generate resources for the thing that you're talking about? Because this does not happen for free.
This is a public knowledge question again. And the question I also have for you, Jay, is what happens to those folks who are in states that aren't covered, say, Texas, and that they are not covered under Medicaid, and that they're just going to try to get away with not having health insurance, so they don't come up to the 100% poverty line, 138% poverty line. What happens to those people in those couple of states? That's my primary concern.
Well, I know we're not supposed to talk too much about the Medicaid expansion.
Well, yeah, we're going to do that next. Yeah, but yeah. So maybe we'll pause on this, because the Medicaid is exactly where I want to go next.
That's what worries me the
Right,
most.
we've got the healthcare on one, the healthcare exchanges on one piece. The next piece is Medicaid, and I don't want people to miss it. So when we come back, we're going to talk about exactly that question.